Welcome back, ladies and gentlemen, and to shed more light over Egypt's the healthcare system or sector in Egypt is in a quantitative leap. We are joined over the phone by Dr. Islam Anan, the professor of the medicine economics. A very good morning to you, Dr. Islam.
Morning, and thank you for having me.
Thank you so much. Doctor, can you tell us how did the June 30th revolution reshape the Egyptian state's philosophy towards the healthcare as a public service?
So that's a very good question to start our discussion, because if we compare the last 10 years in the healthcare revolution in general after the 30th revolution to the previous decades, we can see a lot of transformation. First is the philosophy, as you mentioned, because we were focusing only on the infrastructure, having just more hospitals, the beds, the ICU beds, and so on. But if you look now at the philosophy of the healthcare and the transformation, it's about the person, the Egyptian citizen. And what we call in healthcare, the person-centricity healthcare revolution.
Yes.
Before that, moving from system centricity to patient centricity. What's meant by person centricity is compared to patient centricity. Patient centricity is when you are trying to treat patients. Person centricity is when you are trying that the individual, the healthy individual, preventing him from becoming a patient.
Yes.
And hence, you can find a lot of preventive initiatives, for example. Hence, you will find a lot of programs just promoting health to healthy individuals, not just trying to support patients with medications or with hospital supplies and so on. So this is the part of the changing philosophy of healthcare in Egypt. Of course, it's supported by having a universal health insurance. This is the second revolutionary movement, and we tried couple of times to do universal health insurance, but it's not that successful. But when it was launched by 2018, it was launched with a new philosophy. Start with a pilot, that's why it was started in Port Said. Start with good governance, and that's why you will find that it was not established in one unit under the Ministry of Health, but it's a separate institute authority, which is the Universal Health Insurance Organization, and another entity just to deliver the service, which is the Egyptian Health Authority, and a separate entity, which is very important, to audit the process and to accredit the hospitals who are going to be providing the service, which is directly reporting to the presidential office. Having this governance and separated authorities was the main driver of success of the universal health insurance, to be outside of any conflict of interest can happen between the service provider and the payer himself.
Well, Dr. Islam, also there is something else. What are the most significant structural weakness in Egypt's healthcare system before 2013, and how has the state strategy addressed them?
So we can start with funding. Because
absolutely,
back then, the out-of-pocket was 70%. So 70% of the healthcare expenditure was coming from our own private pockets. And this is what we are reforming now. The main aim is to reach only 20% out-of-pocket by 2030. Currently, we have a balance of 50-50. Of course, it moves slightly year after year. But this is the main funding issue.
Yes.
Another one is increasing the budget itself, because the budget increase, if we are talking before 2013, it was around 30 to 50 billion Egyptian pounds. Currently, we are talking about 250 billion, which is only for the Ministry of Health. If you talk about the healthcare in general, you are talking about 500 billion Egyptian pounds in terms of budget. So that's for funding. Another one is having the infrastructure. Of course, we can talk a lot about it, but just to, long story short, we'll talk about the resources, human resources. We can talk about the hospitals spread across government aids.
Yes.
We can talk about having digitalization infrastructure inside the hospital, that now we are depending on the automation between different authorities. We depend on having files between the Egyptian Drug Authority, the Unified Purchase Authority. We are not anymore a paper-based system. We are migrating from that. We can talk about the process itself, movement from having a slow process disconnected. The WHO used to call Egypt one of the most fragmented healthcare systems in the world.
Yes.
We have a rank. It's not a good rank, unfortunately. It was a bad one. Currently, you are moving towards having an integrated healthcare system. And this is very much appreciated and highlighted in the innovation happening in healthcare. Before 2013, you had a very few innovative treatments for cancer, for example, for autoimmune diseases. Currently, a lot of medications were launched in Egypt. Same year, it was launched in the mother country of innovation, like, for example, the States or Europe. So this is to close the answer. And the outcome itself, we are now similar to the innovative mother of the patent itself, to launch the medication same year as the innovative drug manufacturer.
Well, Dr. Islam, let me take another point. How does the current the healthcare strategy align with Egypt's Vision 2030 and the Sustainable Development Goals for the country?
It's another good point, because if you look at Egypt's vision and moving from system-centered care to person-centered care, if you look at the preventive strategy, and if you look at the Universal Health Insurance Authority, all of these are actually driven from the SDGs, Sustainability Development Goals. And it aligns with two things. It aligns with Egypt's Vision 2030, and it aligns with the Ministry of Health Vision for 2030.
Yes.
And for both visions, you will find that the main focus is having resources, better process, and having a quantifiable key performance indicators, KPIs, having a good health indicators that you can track, mainly on the quantitative basis, which is according to the WHO SDGs. We're talking about longevity and promoting health. And for qualitative aspects, we're talking about the quality of life and how we can promote a better quality of life, a better happiness, health indicators for the Egyptian citizen.
Well, Dr. Islam, also, what is the role has the political leadership played in accelerating the healthcare system?
So, if we are talking about a lot of achievements...
Yes, and the reforms and the developments, yes.
Yes, and the reforms. It starts with a political will. There is no reform in healthcare unless you have a good political will who are actually convinced and driving the success itself. Because you need to make the reform a top-down. The reform system will not going to be in any country, and previously in history, a bottom-up one.
Yes.
So top-down, it means that we have a centralized decision with a good buy-in, and our President Abdel Fattah al-Sisi, most of the times in our celebrations and meetings, he discussed the healthcare system. He was discussing last month what's happening with the Universal Health Insurance Plan and the second phase. So he's having a close eye on the healthcare reform itself, which is very important to us. Hence, you can take the feeling of that healthcare and the vision of having a person-centered care is one of the main pillars for the presidential office.
Yes.
So political will, then having the right people in place. As you can see, you can actually go on and execute the plan. Currently, we have 16 presidential initiatives launched so far. A huge budget and a huge investment, and the main driver of the presidential initiatives is to promote health, preventing a lot of diseases, as we have seen in hepatitis C, as we've seen in HIV, as we've seen in the fetal and mother follow-up. A lot of initiatives we discussed a lot before.
Yes. Doctor, how does the government healthcare strategy balance the universal access for the financial sustainability?
Okay, financial sustainability is the main discussed topic nowadays worldwide.
Yes.
Because you have a lot of disruption in supply, especially after COVID, after a lot of wars. You have a big problem worldwide. In terms of active pharmaceutical ingredients, the main ingredients for manufacturing.
Yes.
You have as well a lot of recessions in economics. So it slowed down and prevented a lot of healthcare projects around the world. If you're talking about Egypt, it slowed down a little bit. COVID, the couple of wars we're witnessing, and the disruption in supply, it slowed down a little bit the execution of the universal health insurance, but it did not stop any program. On the other hand, contrary.
Yes.
You can see, for example, during COVID, that the full presidential initiatives continued the process itself and delivering the medication and the services during the lockdown.
Yes.
And the people who were taking the medication, they were taking the screening plan. So it was on the track. Maybe we pushed a couple of years the finalization of the universal health insurance to be in Cairo by 2035 or 2033.
Yes.
But it's a small drag back in the plan, but it does not stop us from that. Another point
to finalize it, yes, quickly, please. Yes.
Is how you are managing your funds.
Yes.
Because you have a lot of innovation, a lot of needs, but you have a limited budget worldwide, not even only in Egypt.
Yes.
And this is the main core of sustainability. For financial sustainability is to be efficient. Hence, for example, we have a health economics embedded inside the Ministry of Health, and all the authorities work in healthcare. And this is the main objective of health economics.
Thank you so much, Dr. Islam, the professor of the medicines economics, Dr. Islam Anan. Thank you so much for your contribution on the breakfast show. And a short break, and we'll be right back. Ladies and gentlemen, stay tuned on the top of the hour.